I take this opportunity and honor, therefore, to warmly welcome you to this occasion as we commemorate the World Patients Day today. On behalf of my senior minister, the Minister of Health, Dr. Jane Ruth Acheng Achero, I wish to extend her warm greetings and best wishes as we commemorate this day today. Once I'm here, she's here with you. She has not been able to come in person because of other engagements, but she's always, as you know, at the forefront, and she has made our ministry and the government very proud because of her contributions. So she's here, and she wishes us well as we are here. We are all aware that commemoration of the World Patient Safety Day, as Dr. Bayo has said, takes place every day of the 17th of December each year. Today, as Dr. Martin says, we have had it here in Uganda because it's going to fall on when it is a weekend. And we thought that it's good enough that all of us, we are able to be here in big numbers to commemorate it together, other than waiting for that Saturday weekend. Nevertheless, I'm very happy for the organizers on behalf of the ministry that Uganda as a country, we have been able to ensure that we always commemorate this day together as per the World Health Organization's resolution. And I want to look forward that next year, our venue shall be closer to the people, at least closer to the people. And as Dr. Charles Sora has said, hopefully I'll be blessed to be wherever it will take place. Since this day is about the safe patient safety, it's very more meaningful that we move to where those patients are and the communities. And since our general purpose is to create awareness in a way that it touches each and everybody of us. The objectives of the commemoration are to increase public awareness and engagement, enhancement of global understanding, and work towards global solidarity and action by member states to enhance patient safety and reduce on-patient harm. It's a very strong message, and I wish to inform the whole country that the commemoration of this World Patients Day creates opportunity for increasing awareness, preparedness for patient-safe medication, and general measures taken to improve the safety to those under our care and support. Health care, patient care, starts with us, the health providers. So it's not only intended that it is for only our patients, but even the health providers and everybody that is within the provision of health services. We must ensure that we are very, very safe, then we ensure that our patients are equally safe. Therefore, there is a need to strengthen stakeholder coordination and support towards increased demand for accountability and quality services, as well as mobilization for additional support for the highly needed resources to meet the increasing demand for medication, safety, general health care, and support in Uganda. And I want to thank at this juncture all our health partners, World Health Organization, JICA, CHAIN, everybody that now has joined the Ministry of Health to ensure that we provide to our patients good health care, good medication, and safety for our patients. As you have heard the theme medication safety, with the slogan medication without harm. Medication without harm. I want all of us who are here and everybody who is listening to us as we commemorate this day to think through that at one point, at one time, we have all been victims, me inclusive. All of us, we have gone through a stage of self-description, medical description. You get a headache, the next thing you want to do is to go for a Panadol, which has not been described for you. Because you are feeling headache, you are not even interested to know, may this be that headache may be associated with different causes. And you rush to say, no, I think I need a painkiller. And that is what Dr. Charles was saying. As we are thinking of safe medication and the safety of our patients, we still want each and every person to think of your own safety. How safe are you? There are those ones who are in a habit that when you find somebody is swallowing something and a drug, you say, give me a drug. And I'm one of them those days. The moment I see somebody is taking a drug, I say, anyway, this drug is for curing something. So maybe I have some disease that it can also cure me. Why not take it? Because every drug, and that is why I want to appreciate our team from the National Drug Authority, because you have intensified on regulating these drugs in the market. Otherwise, if everybody thinks every type of medicine, every type of drug is consumable, then we would be having a lot of lives lost. So we want to thank you and sincerely say you should keep up on the vigilance of ensuring that we have the right drugs on our market. As I've said, medication safety cannot happen when we have safe medicines. I want to share with you an experience that my old mom, who is about 92, 93 years, at this time goes through. If she goes to a health facility, any clinic, and you prescribe for her a certain drug today, and she comes back for her second checkup, and you give her a different drug, she will not take it. She will not. Whether you say this drug is the same like the other one, she will ask you, then why is the cover different? Why is the color different? Then you say, yes, they are different, but it does the same purpose like the one we gave you last time. She will say, I will not take it. Then you start going again to create awareness. This is a different change, but it does the same things. Now, that answers what Dr. Bayo said, that the people, the patients we are dealing with are now aware of their safety. Aware. So now, if you find my mom at 94 is aware, that means that there is need and urgent need for us to go far and increase on more awareness in our communities. I thank Chain and JICA, but as a ministry and our partners, I call that we should invest more in creation of awareness about patient safety, safety of our drugs. It's very, very important, because we may think that everybody is aware, but here I've given you an example that there is a need to ensure that all our communities are aware of their safety, of their person's safety, of the patient's safety. Because you may have a patient attendant, and this patient attendant, him or herself, is a risk. The health worker may come and say, please, this is what you must be giving the patient. The dose is measured. But when the patient says, I'm feeling more pain, the tenant will say, let me double the dose. doubling the dose, whereas the health provider prescribed the right dose, but the administrator or the patient caretaker, because seeing the pain of that patient and wants to relieve that pain, will say, let me double for you. So you have seen that we still have a big network that we must bring on board if we are to ensure the safety of the patients. It's not only the health service providers, but even those who are taking care of our patients. So we have a long way to go together, and that's why I'm saying that in ensuring the clinician safety prescription, as you have heard, dispensation, administering. You may have a drug which they say you must keep dispensed in a cool place. Then you find that the drug is kept in a very hot place. So all this information must come out very clearly, very clearly. You may have where a patient has been given medicine, oral medicine, for example, the syrups, and takes half of it, keeps the other one for 1, 2, 3 months. When gets the same problem, goes for that one, not knowing that that one has already expired. So there is very need, and the need for this is why today we are commemorating this medication safety, that we keep reminding ourselves as the health providers, as to our patients, to our patient caretakers, to our society. We are in this together. If we are to save lives of our people, lives of our patients, and lives for everybody. As we observe the International Patients Safety Day in Uganda today, we should be reminded that the patient harm due to unsafe care is large and growing globally. Public health challenge is one of the leading causes of death and disability worldwide. I wouldn't want to repeat what Dr. Mbayo has said. He has taken us through where, as health providers, we can avoid causing more harm, and where we can avoid these harms to be inflicted on our patients. Unmet medication safety standards, we have gone through them. They involve practices and errors such as incorrect dosage of drugs, infusions. You put a patient on an infusion, you go away, the drip stops. Nobody is there to change the drip. Air is going into now. You see the causes you are making, then you find the patient again having other complications, swellings. Those are things that we can really avoid. Really avoid. So it's very paramount to ensure that we take patient care, especially the health providers, as per our oath to save lives. Every minute you lose, every single time you delay to take an action, it may be fatal to our patients. Unclear instructions, use of abbreviations, as Dr. Mbayo and Dr. Charles has said. When I was growing up, I would find that on my treatment you write the word RX. I didn't know that RX meant treatment. So my mother would not know what is RX. But curious as she is, what the doctor has written for her. You are not those typists of those long time ago who would write things that are unreadable. So if our medical practitioners can try to write things that are readable, it will help us to avoid such other mistakes. You prescribe a drug that even when you reach to the pharmacy, the pharmacist himself is not conversant with the language you have written. And he's a medical practitioner. But you decide to write it the way you want, assuming that everybody. Now, how will the other one, the caretaker of the patient, reach home and start remembering? But if you wrote it clearly, the caretaker will read it that this is twice a day. You're right, BD. BD now. Birthday, birth what? Yes, you know. But simplify it for these other people that don't understand the language. This is what it is all on today's medication safety. Write in a language that is readable and understandable so that these errors can be avoided. Because somebody will clearly read it twice a day, 3 times a day, 4 times a day. QID. What is QID? Huh? Please. So, the reason we are here is that all of us should share together and see how we can avoid errors that are very avoidable for the safety of our patients, for the safety of each and everyone. Because unsafe and poor quality can lead to high level financial losses each year in low and middle income countries. The government of Uganda is committed to ensure availability of adequate and safe medicines and supplies in the entire country. The reason that we have our National Drug Authority. But still we wouldn't say that other fake drugs are not on the market. They are there. The reason you should intensify to ensure you get them out of the market. Because this is an area where it's very difficult even to trace different drugs, different names use it, different packages, as I've already said, and different prescriptions. Ministry of Health has instituted measures to avert stockouts and expiry of medicines and supplies by empowering lower health centers to quantify and order medicine based on their specific needs. Our workers, the district health officers present here, I know you have your own forums. This goes to you. You have a lot of more drugs that you find in your stores. I have made it a habit when I go to visit your facilities. First of all, storage of these drugs. You must ensure the safe storage of these drugs. Number 2, expired drugs. You have a lot of expired drugs that you find in your stores. Number 3, requesting or procuring the drugs that you really need. If you find that the drugs that you don't need them, why do you procure them to store them in your stores? Maybe they would be needed in Kasese, whereas they are not needed in my district in Zimbabwe. But for you, you just go or with the national medical stores. For them, they give you the drugs according to your requirements. So when you require drugs, that is what the national medical stores will give you. Then at times you hear that there are no drugs in our facilities because you procure or you request for these drugs late. You wait until the other ones are exhausted. You must have that these drugs that we have requested for at least will take us in 3 months. Now, within those 3 months, before they elapse, you have requested for new ones. And those that have expired, you get them from your stock and you take it back. And that is how we can have safety of our patients. Because You have them, you find a patient, you have given the drug that expired. Likewise, the patient will have more drug that is more than, that dosage is more than expected, or at times has not completed the drug. Halfway says, I'm tired and I'm not continuing with this medicine. Breaks. The moment you break the intake of a prescribed drug, that means that you are treating the disease halfway, because you have not completed the circle, the drug circle. Then that's where you find that people now are no longer, they are resistant to the drugs being given. Either you have overtaken more doses or lower as prescribed. So all of this needs to be explained to our people. I'm happy we have our pharmacists here, and I'm sure the message has to go on. So all in all, this day really is for all of us, that availability of adequate and safe medication is highly influenced by our resource, yes, but again, the medication and prescription that we give to our patients outside there. The Ministry of Health appreciates the support and contribution of health development partners. We can't say more. World Health Organization, thank you so much. And you have become part of our family, especially the Ministry of Health, that at every occasion we are with you. We share out every information. We share out every data, not only data, but accurate data, which helps us to plan. We plan together and we move up together. We as a ministry, we acknowledge and appreciate the private sector for their significant support and contribution towards health service delivery in Uganda. The funding mechanisms that constitute 50% of the public health care grant subvention is one area that the ministry and the government of Uganda is more appreciative. The approach has been instrumental in facilitating availability of safe and efficacious medicines and supplies among the health facilities in this country. We want to say thank you so much. The government of Uganda has also put emphasis on the safe storage of medicines, which I have just said, and supplies. Ministry of Health appreciates the contribution and support through Gavi. Gavi have been here with us in Uganda as a country, and the Ministry of Health. We have walked the journey together with USAID and other partners to ensure safety of medicines, health supplies, storage, that you have funded about 19 medicine stores in different districts. We want to thank you, and I want us to applaud Gavi. Ensuring of our better storage facilities, and in doing so, starting with our national medical stores, we really having a new modern warehouse, which is a warehouse of excellency, where central vaccines, and you remember when it came at our time of the COVID vaccines. We are very grateful to Gavi and everybody in that area, especially this facility that now can store all our drugs safely. And then we still encourage all our district health facilities to also ensure that the drug storage facilities are to the standards. We want to thank everybody that has joined hands in sensitization of all stakeholders, especially our local government leadership, our VHTs who are our soldiers at the forefront, and all that those are concerned to ensure that this information, as I've said, JICA, China, and the rest, that this information is disseminated to our people. And of course, our media fraternity, who also continue supplementing and creating awareness. The Patient Safety Project, with support from Japanese international agency JICA, which is of a 5-year plan program, is highly appreciated. JICA, thank you so much. And we look forward to our continuation, strong partnership, collaboration, and support. I know that your attention is to deal within all the 16 regional referrals to ensure that these avoidable medication errors are avoided. I sincerely want to thank Dr. Bayo. I wouldn't want to repeat what you have said, but your presentation this morning as we commemorate this Patients' Safety Day, I am sure everybody who has been here and listened to you attentively has got one or two words food for thought. I picked when you said the global campaign's call to action is know, check, and ask if you are in doubt. In medication, where you are in doubt, have a second opinion. Check and ask. Don't just get the drugs and you just swallow. The mouth can swallow each and everything. Each and everything.